Just a few reflections, really, and I think you always expect this from someone who's doing the afternoon session chairing. But just one reflection I'd like to make was, I called it the Mental Health Network, and actually Mansell and I, working with Malcolm, did the first ever mental health promotion network in Llandrindod, Wales, probably about, I don't know whether it was 10 years ago or so. I think I may have been mental health director in Welsh Government at the time, I can't recall, but I've been affiliated with this network for a long time. And I was reflecting before today and during the day, because it was around 2006, 2007, I gave evidence to the Welsh Government Audit Committee looking at mental health. And one of the questions that was posed to me was, when will we see a reduction in stigma and discrimination around mental health, and when will we see public mental health begin to change? And I remember being a little bit brazen and answering the committee member that asked me the question and said, I genuinely believe that we are reaching a tipping point where mental health will become part and parcel of our everyday lives in terms of understanding our own mental health as much as assisting people and learning ourselves to better manage when we have mental health problems. And what struck me since then, and I think Time to Change Wales has played a big part in this, as well as other media campaigns, but I just think there has been a groundswell in that period where people are beginning to talk about mental health. They are considering their mental health. And I think sometimes that's been about anti-stigma campaigns. I think there has been something of a perfect storm that we've experienced that came on the back of the financial crisis that we saw, where people actually began to think, actually there's more to life than just money. There are other aspects of our lives that are very, very important. And I think since the financial crisis, we've seen really a significant change in people's expectations and their worldview. And I think one of the things that's come through in that is an appreciation of mental health at a time when many people's mental health was challenged. We were talking about people who were uncertain about their jobs, their futures. It's much more difficult for young people to get into the property ladder. This sense of what they're buying to society has been tested, I think, by the crisis that we went through, which is still rippling through and impacting on communities. And there is a risk that in the midst of that perfect storm, that we begin to pathologise what are normal human behaviours, and we start to see things that are illnesses when actually they're just normal reactions to life events. But nevertheless, what is absolutely crystal clear, and I think what we've heard today as we've gone through, from Mansell and his Homo sapiens sapien at the beginning of the day, is the recognition of the human condition. And that the human condition means that we enjoy happiness, but also there is a blessing and a curse in terms of our consciousness. And it can be a real struggle at times. It doesn't take a huge amount to get people to spin out. It can be a life event, most frequently probably outside of work. And sometimes work can become an absolute refuge, really, an oasis in the middle of things that are bearing down on us outside work. And colleagues can be crucially important to support people to get through some of those challenges. Unfortunately, work can be the cause of the thing that causes us to spin out. And there has to be a recognition of those two things, because when we talk about workplace mental health, all too often our beginning and our assumption is that the thing that's making us unwell is work, whereas actually work can be an absolute saviour. And I've experienced that myself. And if you work in a good environment, and we heard this morning about the difference between good work and bad work. Good work can absolutely fulfill you, take you up through Maslow's hierarchy of needs and take you towards self-actualization. It can be a really big part of that. But equally, bad work can be so oppressive because we do spend so much time there, and it can impact on us when we're not in work. In the same way that children and young people who experience bullying in school and then through their use of IT, that continues beyond being in school. And we have to remember how important work is. And I'm inclined to respond in the same way that Mansell did when we asked that question around management and the importance of good management in work, I think it's absolutely critical. And as a manager of a team over many, many years, I think we have a responsibility as managers to take care of our staff and of ourselves, because you can only manage well if you take care of yourself. I think there are a number of things that have come up during the day. The jury's out for me on the question of resilience. I actually think that where we work with people, my first ever job was working in a children's home. And the one thing that was absolutely apparent to me for those children and young people that were in the care of the local authority where I worked was their potential for having resilience through life was diminished by the experiences they'd had that brought them into care. And I think for many people who have had trauma, whether it's in childhood or adulthood, the impact that can have on your resilience has to be recognised. And there are steps you can take to try to rebuild that resilience, particularly if you've got good social networks that can be helpful. So I don't know. The jury's out for me on the question of resilience. I think resilience is very, very important. I'm not sure courses on resilience are the answer, but certainly having a mind to resilience is very important. And I think the work that's been done in Public Health Wales recently on the ACEs, the what does it stand? Adverse childhood experiences, which are absolutely fundamental in terms of making us who we are, and those things that we carry with us through life are really important. There's a few other things I'd like to mention, and I'm conscious it's a sunny day and you want to be getting back out into the sun. And one of them that really came out through the day is that there is an importance of focusing on the individual, which is about reacting to people when they clearly need help and support. And that's about being not just a good manager, but a good colleague. And I think that shouldn't be forgotten. The other one is about the responsibility for making our working environments good places to be. We make good work, not buildings. It's the people that work in them that make good work. And there's a management responsibility and a peer responsibility about making work a good place to be. It's not, therefore, just about reactivity or proactivity. It's about both. The other thing that's been a message that I've heard coming through today, and I saw it on the poll, and I've heard it in the conversations going on in the room, is about being listened to. It's about, if you're going to work with your staff, don't just give them time to speak. You have to really listen to what they're saying to you, and you have to react to that and respond to that. And slightly on the same topic is the issue of language, because that's been a recurrent theme that's come up, that sometimes the way we frame the language about what we do frames the response that we may get. And I heard talk earlier of a welcome back to work interview rather than a return to work interview. The fact that sometimes we use the language around occupational health, and actually that should be something which is hugely supportive, but sometimes it can be used almost as a stick to beat someone with. And I'm going to refer you to occupational health can sometimes be read as this is now the start of us taking this process somewhere else, rather than that being a supportive approach to help that person to deal with the challenges that they're facing. And I think the way that we use language, the way we use the systems and within the organisation are critically important in terms of making the workplace a good place to be. And I think it was really brave and very revealing when Adam stood up and told his story. But in that, he talked about his relationship with occupational health and how that, in those days, had been something of a barrier in terms of his recovery and return to work. Because what we shouldn't lose, and Mansell, myself, and Carol Black used to talk a great deal about being work ready rather than fully fit for work, and that concept's really important to hold on to. And the longer a person is away from work, the greater the chances they may not return to work. So OH should be a vehicle for helping people to get back to work when they're work ready. I think, for me, though, we had a good conversation around ageing in the workplace, and that was the thing I mentioned, that the title was challenged, which was making our workplaces more age-friendly. And I think actually the sense in the room was we just need to make workplaces friendly. And I know friendly is a bit of a glib term, but it's actually not about being age-friendly or carer-friendly or friendly and supportive at the time of illness. It's actually about having a good working environment and actually people looking out for each other and having a wholly supportive environment. And so it's not about attaching caveat to how we support people, that you have to be in this position or that position or the other position. It's actually about being mutually supportive all the time. And I don't think we should be afraid of understanding that if we don't look after our staff, our productivity will drop, our sickness absence will increase, the quality of the service we provide to the people to whom we care, and there's quite a few people here in the NHS and other services that reach out and serve the public. And we have to take responsibility for that, because it's part of our governance of managing a service and managing the finance of that service that we make that service effective. And the thing that makes the service effective is having an effective workforce. So everything we've discussed today, to me, comes back to that, which is about the responsibility we have to individuals, the responsibility we have to the organisation, and the responsibility we have to the public in terms of making our workplaces good, vibrant, healthy places to be. And that we, when we're bringing young people into those environments and we have the responsibility for them, that we make those places where they will grow, that we act as role models to those young people as they come into the workforce, and that's all part and parcel of having a healthy workplace. There's been some really good introductions to the resources that are available. We heard from Mind. I've heard people talking about the corporate health standard and its application. These things are there. And the thing that's really pleasing for me, and I'll stop talking now, is when I look back to that health committee and the audit committee looking at the future of mental health in Wales, the journey we've come on in just those 10 or 12 years has been phenomenal. So, long may it continue. I think the fact that we are now embracing positive mental health as a positive attribute, and we're not just talking about mental illness, is the way forward. And so thank you very much for putting today's event on, Malcolm and colleagues. I think it's been really helpful. I've taken many things from it, and I hope that you will too. Just one last question. Is there any burning issue anybody's got that they want to raise that has been triggered in their mind while they've been here today that they think it would be useful to share? And if not, I'll say thank you very much and we'll get on our way. No, the sun's out. Okay, thank you very much, and don't forget your forms.